Good evening. Hello, welcome into this important webinar about why we need a zero-COVID strategy. My name is Coral Jones. I'm a GP in Tower Hamlets and Hackney for the past 25 years. I'm a chair of the London Socialist Health Association. I'm a member of Doctors in Unite, and my constituency is Hackney South and Shoreditch. At this Labour Party conference, we must argue powerfully for a zero-COVID strategy to become Labour Party policy. Zero COVID means stopping transmission of the virus to keep it safe. It does not mean trying to totally eliminate the virus from everywhere. That's just not possible. The Tories have used the COVID crisis to enrich their corporate friends and Tory donors at the expense of our lives. The UK has one of the highest death rates in the world, but we cannot live with this virus. The vaccination program has decreased deaths by 80 to 90%, but despite that, there are still over 1,000 people dying every week. Ongoing high rates of community transmission mean there are more infections, more hospitalisations, more deaths, and a perfect breeding ground for variants. This virus shows no signs of mutating downwards to become like the flu. Vaccination alone cannot eliminate infections. The Delta variant replicates very rapidly in the upper respiratory tract for the first 3 days before our immune system recognises that it's there. And this is why there's a high risk of transmission once people are exposed. The spread of COVID is airborne. To stop spread of the virus, we need public health measures as well as vaccination, a robust public health track and trace system, financial support for people to self-isolate, ventilation with monitoring and air filtration if needed, masks and physical distancing. The Tories have failed to protect people, and they have also failed to keep the economy running, which is what they claim. We have continuing cycles of infections, deaths and lockdowns. The Labour Party must reject the Tory choice of lockdown or letting the virus rip through the community. We can still function as a society while staying safe. This is a political choice. The speakers tonight have campaigned widely for a zero COVID policy inside and outside Parliament. Our focus tonight is how to effect change politically. We have a total of 6 speakers, and the meeting will be put up online on Twitter, Facebook, and the YouTube channel under the Zero COVID Coalition. It gives me great pleasure to introduce Nemo Hussain, who will give a speech for Diane Abbott, which has been pre-recorded. Diane needs no introduction. She's a long-serving Labour MP and a great fighter for social justice, and one of the co-conveners of the Zero COVID Coalition. Thank you, Nemo.
Thank you, Coral. From Diane Abbott MP. Thank you all for coming this evening, to our great speakers, our wonderful chair, and to all of you watching on your laptop or phone. I'm very sorry I cannot be with you this evening, but I wanted to share my thoughts on where we are in the fight for a zero COVID policy. As this is a global pandemic, I think it's important to start with an international perspective. According to the official data compiled by Johns Hopkins University, over 4.7 million people have died. This is a disastrous total. But The Economist magazine, using excess deaths data from around the world, puts the death toll at over 15 million and possibly over 18 million. This is death on the scale of a major war. Estimates for the total dead caused directly by the First World War range between 8.5 million and 15 million dead. So you see, this is on a scale comparable to a world war, and this war is not yet over. We should be clear, though, that in many parts of the world, the populations of some of the poorest countries are being left to fend for themselves. Only 1/5 of the world's population has been fully vaccinated. Across a number of continents, more than 40% of the population has been vaccinated, yet in Africa, it is less than 7%. Put another way, having presided over the carnage of its own population in the pandemic, some of the richest countries in the world are denying vaccines to most of the world's population. The reason for this is also clear. If vaccines are bought, then donated, the big pharmaceutical companies will still make huge amounts of money. If instead there is a waiver of vaccine patents, then production of vaccines can take off rapidly all over the world. This is what the world needs. This is what the world demands. This is what is needed to help the world's poorest and most vulnerable. In this country, we've been told repeatedly that the pandemic is all over by February this year, as one of the tabloids claimed. But we have now a policy where there might be an amber light flashing if deaths go above 50,000 a year again. But in the last 7 days alone, there were 974 deaths, almost 1,000 a week. That is already at pace for 50,000 a year. Surely even this government isn't waiting until there are further 50,000 dead following so-called Freedom Day. This is the central problem that we are meeting to discuss. This is the political problem of adopting a zero-COVID policy, because we know it can be done. It was almost done even here. In August and September last year, here after lockdown, we got down to 7 deaths per day and much lower cases than now. But there are 2 major failings. The government would not wait until we got to 0 deaths and much lower case levels. From there, you can achieve a zero-COVID policy. But that means following through on suppressing the virus. It also requires a whole set of other policies, which many will be familiar with. You need a proper test and trace system, and you need full support for isolation, including full pay. You need mitigation measures for essential workers, proper support for the self-employed, and increased resources for the overstretched NHS, including proper pay rises for key workers, doctors, nurses, yes, as well as porters, cleaners, cooks, etc. But that is exactly what is lacking, the political will to implement a zero-COVID strategy. At every stage, by its own admission, this government has prioritized the economy over people's lives. Ministers seem to take no account that this policy has not worked even in its own terms. We have had one of the steepest recessions and one of the slowest recoveries in the G7. Putting the economy first has led to a huge death toll, as well as huge economic damage. This is why we need a policy change, because there has already been a disastrous outcome on public health and a disastrous outcome on the economy, with hundreds of thousands of unemployed and millions suffering pay cuts. I think it's great that we have people here tonight who continue the fight for a zero-COVID policy. We need to oppose this government's policies. We need to propose policies that will defend the basic interests of the population, their health, their well-being, their living standards. We cannot simply shadow a government which has presided over a huge death toll and continues to preside over a huge number of deaths. We have to fight for what's right. We have to fight for zero COVID. Thank you.
Thank you very much, Nemo. Diane has summed up all the major issues there perfectly. So next we have Rohit Dasgupta, and at the recent Labour Party London Regional Conference, a zero motion was proposed and passed on the floor, and Rohit was involved in the team that did that. Rohit's also a member of the Labour National Policy Forum, so he'll be able to give an overview of how we can move forward on this policy, both from the grassroots through the CLP and from a national perspective. He will highlight who our allies can be and what are the potential pitfalls ahead. Thank you, Rohit.
Thank you, Coral, very much for inviting me today to speak on this. And also, I'm grateful to everyone who's listening to us today. So my name is Rohit Dasgupta. I'm actually a local councillor in the London Borough of Newham, where I have responsibility for social integration and equalities. So what I'm going to do today is I'm going to talk a little bit about the kind of work that we have been doing in Newham as a local authority, and then I'm going to kind of try and make some connections between how we can make this a more of a national campaign than just what's happening in different local authorities and communities. So I'm sure all the speakers over here will be aware that Newham is a East London borough. We have one of the youngest populations in the UK, and also it is one of the most diverse boroughs with 100 languages spoken and 48% of our residents being born overseas. We are a borough which has got a long history of migration, but also at the same time, we are also one of the most deprived boroughs in the country, currently ranked 12th in the UK. And over a quarter of our neighborhoods were in 20% of the most deprived neighborhoods in the country, and 4 of which were in the 10% most deprived. So based on the data that we've seen from the first wave of the pandemic nationally, we've seen that mortality rates from COVID-19 in the most deprived boroughs areas were more than double the least deprived areas. And the ONS reported, for example, that occupations such as taxi drivers, bus drivers, sales and retail assistants, construction workers and social care workers had significantly higher rates of death. These are also professions that made up a bulk of Newham's population. Our residents are also at the very front line of the housing crisis, and this has been exacerbated by COVID. We have around 70,000 privately rented households, with many private tenants working in low-paid, insecure employment in sectors that have been the most impacted by COVID. And they spend on an average, like 31% of their pay on rent. And we've seen that there has been a manifold increase in homelessness since COVID, and the economic impacts of COVID, are having a tremendously bad effect on the security of housing in Newham. And there is continuing concern that our residents tell us about being evicted from their private rented sector. And there is likely to be even more greater impacts on residents who were already struggling financially before the pandemic. 54% of the Black, Asian and minority ethnic households living in the borough were living in poverty compared to 37%, for example, of white households. Residents in Newham have also complained about living in very overcrowded housing, and they are much more less likely to isolate themselves if they have COVID-19 symptoms, which also increases the likelihood of the virus in overcrowded households and multi-generational households, and which has had has been a very significant factor as well in the high mortality rate that we have seen within our Black, Asian and minority ethnic communities. In fact, it is, Newham is one of the most overcrowded boroughs also in the country. What the pandemic starkly demonstrates is the health inequalities that is prevalent in boroughs like mine, and the need to work even harder to reduce these inequalities that are faced by our diverse population. Wider health determinants have increased the impact of COVID-19 in Newham more than average. And the pandemic has all but shown, and I keep reading about this, well, at least I used to read about it, being this kind of great leveler, but neither is it that or something, and neither is it going to ever go away soon. The government keeps telling us that we have to learn to live with it. Well, I think the government should know that many of us in circumstances where living with it is just not possible. I live with a partner who is vulnerable, and every time I go out, I'm absolutely scared about what I might bring back. During lockdown, we also spoke to our residents who did not know what the future would hold. The employers tried to make them redundant despite the government's assurance of furlough, and with many residents, working from home was all but a distant reality. These are also residents who are forced to still continue to work, often in very unsafe environments. And lack of government support meant social distancing and working from home remains a distant possibility for many of them. We know clearly, and if we ever needed a reminder, that poverty and race inequality lowers life chances. It manifests in COVID-19 mortality rates, in health inequalities, and in jobs that expose the precarious daily choices that are being made by so many of our residents simply to earn a living. The monumental impact that COVID has wrought in our lives and the ways of living requires us to radically rethink and provide bold interventions to accelerate change. As a Labour administration in the borough, we have tried to provide that support and leadership that sadly our residents lacked nationally. Whether it was through mass vaccination events, which saw a huge take-up, to setting up Help Newham, a vehicle through which we provided more than 100,000 food packages, provide prescription delivery for over 15,000 residents, and created a team of over 500 COVID health champions, which still continue today to make sure health information was being provided to our most vulnerable communities. We also worked with our VCS sector in setting up mutual aid groups. The government taking off all restrictions is one that we must absolutely condemn. They have let down our residents. They call it Freedom Day, but whose freedom is it? It is regional and local administrations like ours who have taken on the leadership. Providing the support and health advice should have been coming from the national government. It is good to see in London, mandatory face masks still remains a policy in places like the TfL, but more needs to be done. Our key workers from health to retail need to be supported so that they don't feel like they have to compromise on their safety or fear losing employment. The traditional approaches to developing and supporting the economy are just not working well enough for our residents in Newham. It is why we have adopted community wealth building, driven by our inclusive economy strategy, which sits at the very heart of our council policy, building on the principles of economic, social, and environmental justice, so that long-term prosperity, fairness, and well-being can be embedded for all residents in our borough. Our recovery strategy, and if you're interested, it's available online on our website, is driven through these 8 pillars of well-being, access to work, accessibility, housing, and a fair economy. One that is underpinned by the beliefs that we need an economy that works for our residents and delivers a place where communities can share the benefits, no matter what their background. I would also like to make a point to suggest, and as the speaker prior to me, as Diane also mentioned, this is not just about what happens within our borders, but also what is happening internationally. In April, I traveled to Kolkata in India, where my parents live, due to the ill health of my mother. This was just before the country was put on the red list and the Delta variant was discovered. Vaccines were low. A mere 4% had been vaccinated, mostly middle class and upper middle class people in the cities, and the hospitals were overwhelmingly full. Every time I stepped on the balcony, and I do not exaggerate, every 15 minutes, you could hear an ambulance passing by. My uncle suddenly contracted COVID during this time, and despite trying our best to get him oxygen or even a bed in a hospital, unfortunately, we were not able to, and he died in the car as we were driving him around. For people like me who straddle multiple geographies because of our family, things feel very dissonant. As I returned back to London in May, and UK was celebrating opening up and things returning to normal, I was confronted by images of economic precarity and the necropolitics of geography, which doomed friends and relatives of mine in India literally to starvation. It doesn't have to be like this. We need to call on the powers to make sure that we don't learn to live with this virus, but proactively work to eliminate it, to work and support our partners in the global south so that we can work together to provide the life-saving vaccines that are needed and eliminate this virus. The only way forward is a fair distribution of resources and the political will to make zero COVID a reality. So let's continue to lobby this government and make elimination of COVID a global reality. Thank you very much.
Thank you very much. That's, Josh, I just wonder, we've got Helen on board at the moment. Is there, Bonnie hasn't come yet, so, okay. So next we have Helen O'Connor, And she's from one of the largest unions affiliated to the Labour Party, the GMB. Helen's a former nurse who is now an organiser for the GMB. She's a staunch campaigner for the NHS and the conditions and pay of all its workers, not only directly employed from the NHS, but also outsourced workers. She'll speak to us about how the government is using the pandemic to undermine the conditions and pay of workers and about some of the specific pressures on the NHS. Thank you, Helen.
Thank you very much, Coral, and thank you for inviting me to speak. And I'll focus on what my trade union, GMB, is doing going forward. But I'd just like to start by saying at the outset of the pandemic, it was my union that was at the forefront of the battle to get PPE, personal protective equipment, into the hospitals, and we led on the guidance around COVID workplace risk assessments. And we put as much pressure on this government as we possibly could around the quantity and the quality of the personal protective equipment available to workers who are keeping society running. And mostly they were our members, the bin workers, the hospital workers, people in the supermarkets, utilities, etc., all GMB members. And what's remarkable about this pandemic is the fact that due to cuts, privatisation and the Tories' devil-may-care ideology, they were not prepared for this pandemic. What is equally remarkable and unforgivable is that there were tried and tested methods of dealing with pandemics, and the Tories claim it was an unprecedented situation, but it actually wasn't. And the strategy and the plans on how to deal with pandemics were there, but they weren't used. And the Tories decided to ignore everything and create a false choice between health and the economy, between protecting people and protecting profits. And the end result was they failed to save lives. There was tens of thousands of deaths, and they also failed to save the economy as well, actually. And these people are just not fit to govern us. And health and safety should never be based on choice and individual decision making. That's what bad employers this government want people to think. Health and safety protection should be based around proper assessment and actual risk. And what we've seen in this country over the last few decades is the complete slashing and burning of health and safety regulations, which were dismissed as unnecessary red tape. And we've also seen a program of disinvestment in the health and safety executive as well. And workers in other unions other than GMB have campaigned and are still campaigning on the question of health and safety in workplaces. And it's no exaggeration to say that the National Education Union, for example, played a great role in forcing the government back on a number of issues during the pandemic, because they wanted not just to protect school kids, but also the families of those school children as well. And as we meet here tonight, workers at the DVLA in Swansea are campaigning for their right to a safe working environment, and they've taken industrial action on it, and they've won solidarity across the movement. But the battle for proper health and safety in our workplaces is going to be a hard one, because in the DVLA, those workers actually secured a health and safety agreement with management, and that was then overturned by grant chaps. And what's the reason for this? The Tories are determined that the millions of workers will be forced back into workplaces that are unsafe, because they don't want to spend the money on the improvements that are necessary in virtually every single workplace up and down this country. But more importantly than that, they don't want to concede the union power in ensuring we all have safe working environments. That's the nature of the battle that we're involved in at the moment, and it's one we have to win. The manipulation of the Tories knew no bounds when it comes to risk, which was clearly demonstrated at the height of the pandemic, when the deterioration of mental health was actually put forward as a bigger risk than death from COVID-19. And when it comes to health and safety in this country, we're facing both unscrupulous employers and an unscrupulous government. And it's not a good position to be in, especially as people are now being forced to go into unsafe workplaces. And this will have serious consequences for the poorest and most vulnerable in our society, because it will accelerate the spread of COVID-19. And it's the most vulnerable and the poorest will have the worst impact on. The growing number of workers even who are living in unsanitary conditions, overcrowded conditions, who are malnourished, they're all at risk of becoming seriously unwell and dying with the virus. So in the trade union movement, it's really important that we organise around health and safety, and we put health and safety in workplaces at the absolute forefront of our agenda. And the majority of health and safety issues in workplaces affect more than just one person. So it's easier to get colleagues into a union and active in a trade union around those issues, and then build towards collective action. Fire and rehire is another live issue for us currently in the unions. And it's fair to say that the economy is plunging further into crisis. Inflation is now running steadily higher and higher. And the bog standard answer to any crisis seems to be, when a strategy fails, do more of the same strategy. And we saw this during the lockdown, when there was constant stop-start lockdowns during COVID that had disastrous consequences. During the banking crash in 2008, ordinary people had to pay to bail out the banks. And the same demands will be made of our class again during and after this COVID crisis. Working people will be asked to pay for this crisis in lots of ways. And fire and rehire is just one of a range of tactics that will be deployed to pull back money from the working class. And fire and rehire has always existed, but in the past it was the very worst, most scummy employers who resorted to it. Now we're living through a new post-COVID barbarism where this fire and rehire tactic is being rolled out across the board. And never before has the demand to renationalise rather than bail out failing companies been more necessary. And in the labour and the trade union movement, we cannot tolerate a situation where any company, whether profitable or failing, takes hard-won pay and rights away from the workers who've created their profits and their success in the first place. And we welcome the bill currently going through Parliament to challenge fire and rehire, and it must be fought, this tactic, on the industrial and on the political planes. And I'll finish on this point. The trade unions, including GMB, are the largest democratic organisations in society. And during this period of pandemic, working people are once again starting to realise that trade unions are actually a force for good. And we've all worked tirelessly to keep everyone in society safe in the trade unions. And it's unions like my own, GMB, we called for a people's bailout at the start of the pandemic. That led to furlough, and the rollout of furlough, inadequate as it was, showed just how quickly action can be taken when the political will is there. And the political will never be there without a clear set of demands and the proper organisation of working people. So in the GMB, we know that it's our members who do the jobs that are necessary to keep the whole of society running. These jobs are essential to society, and it's very important in GMB that our members' voices are heard politically. And this Tory government must be challenged politically, because they're not only attacking pay terms and conditions, they're destroying the very fabric of society. So we cannot let politicians off the hook. Trade unions cannot and will not endlessly throw funds at politicians who fail to represent the interests of working people, because we are answerable for every penny of our members' money that we spend. And the cuts that are taking place, that are lining up the NHS for privatisation, are unacceptable. Our members suffer the harsh brutality of privatisation every day, and politicians ignore these realities at their peril during elections. So we must all unite to be the strongest advocates of the public sector and demand that all services are brought back in-house. So we've much to fight for, but the very last thing I want to say is that there is the Tory party conference in Manchester, the 3rd to the 6th of October, and I'm on the People's Assembly. The People's Assembly is having a huge event, and we're having a big national demonstration, and we're calling on all of you across the movement to come and support that and oppose this Tory government. Thank you very much.
Thank you very much, Helen. You've brought a very important perspective to this discussion this evening. Thank you. Next, we have Bel Ribeiro Addy, who I understand is squeezing us in between her other commitments. So thank you very much for coming. And as many of you will know, Bel was elected as the Streatham MP in the 2019 election. She's been a great advocate for a series of important campaigns, including the campaign for ZeroCovid. She'll be able to tell us what the obstacles to getting a ZeroCovid policy adopted are, and how to force a change of government policy, as well as to bring up ZeroCovid up into the agenda of the Labour Party. Thank you very much.
Thank you very much for inviting me to speak to the organisers, and of course the great chair and the great speakers we've heard from already. I don't really want to repeat any of the points that have already been made. We have learned that the objective situation is very bad, both internationally and nationally. We've also learned there are lots of people who are fighting for a zero COVID policy, and some of them are winning. And that's really encouraging and really important. And it's important that we don't stop, no matter how much people tell us that the pandemic is towards the end. There is always a place for a zero COVID policy, within this country to stop infections rising. This is a serious fight, and sometimes there are amusing moments. You may not know this, but at various times over the last few months, both the ZeroCovid Coalition and Diane Abbott as co-convener have come under attack from the Financial Times, the Daily Telegraph, and the Sun. Some might say it's a badge of honour. And unfortunately, these attacks are not because our campaign has hundreds of thousands of members or the majority of MPs or can say we have won the argument, but the attacks are because of the seriousness of the situation and because we're offering an alternative. We have to accept first the government policy on failing to tackle the pandemic is a major keynote policy of this government. It's central to almost everything the government is doing. We heard earlier the death toll is comparable to a death toll from a world war. Well, when there's a world war, everything from social policy to health policy to policies on work and education, as well as foreign policy, is in part determined by the conduct of the war. We also know that every type of inequality, oppression, and discrimination are being exposed and deepened during this crisis. This too is part of government policy, and from a government which denies that institutional racism even exists. We also know that every sort of regressive legislation is being enacted to remove the government from scrutiny or checks or accountability. State forces are also being removed from accountability, even to the point that police officers and armed forces personnel are exempt from prosecution for crimes up to and including torture, rape, and even murder. The most basic rights to free speech and right to free assembly and the right to protest are being trampled on by new laws. And all of this is being done under the cloak of the pandemic, under this reactionary government's so-called emergency powers, which have long outlasted the emergency. So the government's terrible policies on responding to the pandemic is something of a cornerstone of all government policy. It's not willingly going to change its policies at all. But there are a number of pressures that the government has had to contend with. The first, of course, is the rising death toll in itself. We know that Boris Johnson has a friendly press, but letting the bodies pile higher will become harder and harder to defend. There is also pressure on the NHS itself. There has been a widespread impact because almost everyone uses the NHS or worries that they or their loved ones will need the NHS. And we've already seen that the army has been relied on in both Scotland and Wales because the NHS couldn't cope. In a number of localities in England's A&Es, we have been closed to all non-COVID cases, and there's a long-standing and huge backlog of elective cases. If the pressure on the NHS intensifies, this will be hard to keep off the political agenda. There is also a potential crisis in schools, colleges, and universities. Last week, in a single day, there were 100,000 pupils off school. And remember, this is not students shielding or self-isolating because that is not allowed now. This is pupils with symptoms or with positive tests. And there are reports that cases are already at a new high in the schools. This will keep parents and carers off work anyway, as well as increasing their justifiable anxiety. It's also extremely doubtful that the economy will recover strongly and that unemployment will improve. It's very difficult to have a robust economy when people are ill themselves or have increased care responsibilities or are simply reluctant to socialise if they risk contracting the virus. This highlights a central fallacy of the entire government strategy. There is no trade-off between public health and the economy. What's good for people is also good for their prosperity and vice versa. In general, countries with the worst COVID-19 outcomes like ours also have the worst economic outcomes. Now, one of the central charges against the whole campaign for ZeroCovid, a charge made by the newspapers I mentioned earlier, is that we want permanent lockdown. But that charge is posted to the wrong address. It is this government which has had more days of national lockdown than any of the countries like China, New Zealand, or Vietnam, who have successfully suppressed the virus because they suppressed it and because they had a zero-COVID policy. And as a result, we now face a political obstacle to adopting the correct policy. It's not a problem of resources or some sort of technical problem. The first thing we need is a robust opposition to this terrible policy and this awful government. And that means prioritising public health, safe in the knowledge that with sensible measures, the economy will be in a better shape than from the policy of letting the virus rip through the population. We also need to listen to unions and their workers and not go up against them when they raise quite legitimate and very serious concerns about health and safety. We should listen to health professionals when they say the current situation is grave and deteriorating. We should also ask for a proper pay rise of 15% for our healthcare workers and no pay freezes for any workers. We need to break with the mentality that says a minority of voters voted for the Tories at the last election, but they got a huge majority. So that means that everything they do is popular. That's completely wrong. There's no logic in that approach and no common sense either. In fact, throughout the entire and a far greater proportion of the population, far more than the Tory vote in 2019, they have been extremely concerned about the virus and have opposed premature lockdowns and have maintained their own mitigations, including mask wearing and social distancing. Despite the publicity they receive, the anti-vaxxers are cranks who represent no one. Just 10% of the adult population have not been vaccinated, and some of those would like to be because they are likely to be because they're immuno-suppressed or some other legitimate and important reason. Above all, we need great campaigners like all of you that are on the call today, and we need to stand for what is right. In the opposite of Dominic Cummings' infamous phrase, we should not let the virus rip. We will not put the private sector first. We do care about all deaths, including the elderly and the frail and the disabled, many of whom have suffered the brunt of this virus. And no matter what anybody says, we do need a zero COVID policy. And the Labour Party conference is the next arena where we can take up this fight. So I hope to see some of you there. And thank you very much for listening to me this evening.
Thank you very much. That's really good to take the fight into the Labour Party conference. Our next speaker is Bonnie Craven, and Bonnie is from Sutton and Sheen Labour Party. She was the Labour Party candidate there at the last election, and she was part of the team that got the zero COVID policy adopted at the recent London Regional Party Conference. And she's been a long time campaigner for the NHS. And she's going to speak about how the government is using COVID to undermine the NHS even further. Thank you, Bonnie.
Thanks, Coral. I'm really pleased to have been invited to speak on this. Thanks very much for having me. The past 20 months, we've seen the management of this pandemic, which is possibly worse than an ep. In fact, if our government was aiming to cause as much death and destruction amongst the working class, elderly and chronically ill, could not have done a better job. The BMJ described their actions as social murder. We've also seen the distribution of millions of pounds of contracts to people who have direct contact with the government, something which, in my opinion, is far more scandalous than Hancock's sleaze. Over the last few months, we've become increasingly aware of millions and millions of pounds handed over with absolutely no scrutiny or bidding processes in place. Ministers have awarded contracts to their friends, some of whom have had no experience in delivering the goods. Michael Gove recently was found to have acted unlawfully when he gave a contract without tender to a polling company owned by mates of his and Cummings. And who could forget the at least £40 million given to Dido Harding for a track and trace app that never worked, or the PPE contracts worth more than £17 billion, which the National Audit Office found the Cabinet Office and the Department for Health and Social Care deserved criticism for the lack of transparency, conflicts of interest, and the personal connections with the ministers. This week, it's been found that another £85 million worth of contracts awarded to Abingdon Health were won through a so-called VIP lane. Matt Hancock apparently awarded a £30 million contract to his old landlord, and just yesterday it was ordered that there be a search through Hancock's WhatsApp messages and personal email accounts. This is not how government business is supposed to happen. The dominance of pharmaceutical companies in finding a vaccine has been morally wrong. Patents for the vaccine should have been waived to enable countries in the global south to access vaccine. the only realistic way now to get control of the virus. So long as COVID-19 is able to rampage through international populations, we will see a proliferation of variants. This is, after all, a pandemic, and we do live in a global village. Proper and effective track and trace needed to be implemented in February 2020. Individual cases could have been isolated to prevent avoidable transmission, as they were in New Zealand, for example, at least until effective vaccine was available. Instead, we've seen too late lockdowns, confusing and conflicting rules and guidance, and an enormous transfer of wealth from the pockets of the poorest to the billionaires. Families should never have been forced to send their children into schools completely unprotected. Over a year on from the first lockdown, nothing has been done to reduce class sizes. There is no real filtration installed, social distancing is impossible, and masks are not mandatory. Labour's line of send them back, no ifs or buts, was entirely unacceptable, especially where children live in families with clinically vulnerable or clinically extremely vulnerable people. With case numbers dropping when schools were on holiday, it's clear that schools and colleges are significant vectors of transmission, which is entirely predictable. There is, of course, also growing evidence that children suffer with COVID, and the consequences of long COVID in them remains unknown. CEV families' Freedom Day, so-called Freedom Day, was anything but. They were forced into a position where the so-called freedom to not wear a mask or to go out for a drink seemed to trump right life for so many. I'm pretty sure most of us now have lost at least one person close to us to this awful disease that has not gone away. We need to protect frontline workers in health, travel and retail. We need them to look after our most vulnerable, who we also need to look after, and we must stamp out this virus on the basis of a zero-COVID policy. Measures must be put in place in the UK, and outbreaks need effective containment. The environment was massively helped by the reduction of travel by so many people around the world, and the traffic light system the Tories designed was insufficient to prevent international transmission, and now the world views us as Plague Island. The enormous handing over of huge amounts of public money to private companies without tendering during this pandemic has aided the transfer of public money to private pockets, with, it seems, no conditions applied. It looks as though the government have exploited this global health crisis to line the pockets of their friends with public money, and there were inadequate consequences for their failures to deliver. It should worry us all. The latest NHS bill going through at the moment will see contracting processes for every single service in the NHS take precisely the same form as we've seen over the last 20 months. The rampant privatisation of the NHS must be stopped, and we absolutely have to lobby every politician to vote against this new legislation, which will embed these appalling practices in every transaction on behalf of the NHS. With well over 150,000 deaths from this virus in this country and unquantified numbers of people who may now live for the rest of their lives with impairments or disabilities, we actually need to have in place a policy for zero COVID. If that was in place from the outset, we would of course not cause so much death and devastation, which incidentally disproportionately impacted people on lower incomes, in public-facing jobs and in BAME communities. Then, of course, we would not have seen the transfer of millions or maybe billions of pounds from our pockets into the pockets of mates of this government. I was really, really proud to second the motion for a zero COVID strategy at London Region Conference. At National Conference next week, I'm really glad to say my own CLP contemporary motion is to remove the private sector from the NHS and demand that it is once again a publicly provided service, based on the needs of people rather than the profits that can be made from it. I'm also pleased to share with you the emergency motion which we submitted yesterday for National Conference. In this motion, we express deep concern that the government is still seemingly resisting transparency over key decision-making during the pandemic, and it calls on the Labour frontbench to press for full disclosure of COVID contracts by the government to avoid delaying the inevitable. And And we will also our motion further reinforces the ongoing demand for an urgent public inquiry into the mishandling of the COVID pandemic to bring answers to the families of victims, as well as a full explanation to the UK taxpayer as to whether vital money was wasted and whether or not claims are correct that procurement favoured the associates of the government's ministers. We must demand answers to these serious questions on the deliberate decisions of this government over their handling of this pandemic, which has seen our people die and their friends get rich. With conference next week, it is absolutely crucial that we raise awareness of the deliberate actions of this government over the handling of COVID, and of course, challenge any Labour politician who has not yet held the Tories to account. A zero-COVID strategy from the start would have saved possibly all of those lives, or at least a great proportion of them. And this is our chance to push harder for what we need to see to save the lives of our people. Thanks ever so much for letting me speak. Really appreciate it. Good luck.
Thank you very much, Bonnie. And we look forward to these motions coming to conference. Our last speaker is Sonali Bhattacharya, and she is a writer and an award-winning playwright. She's also a political activist, and I understand you're the National Secretary of Momentum. You're a very organised person then. So she will speak about the complementary ways in which the Labour Party unions and campaigns can work together to raise the issue of the pandemic and around zero COVID, and to promote zero COVID both within our organisations and into the wider Labour movement. Thank you very much.
Thanks, Coral. Yeah, Sonali Bhattacharya. I should always do a phonetic writing of my name ahead of any call. Thanks so much for inviting me. That's okay, thanks, Coral. Thanks so much for inviting me to speak on behalf of Momentum on this important call today. So yes, I'm a writer and activist, and I'm also National Secretary for Momentum and also London Regional Rep. So we at Momentum have been responding to the COVID crisis in a variety of ways. We've been working hard to counter the concertedly confusing and divisive narrative put forward by the government since the start of the pandemic, ignoring the science in favour of the quote-unquote economy, which in reality, as other speakers here have outlined so eloquently, has been a corrupt system of greed that has only benefited the Tories and their cronies. Our videos and other comms are focused, among other things, on the vast difference between our government's negligence compared to New Zealand's leadership, and the attempt to divide NHS staff and teachers around the need to close schools at the end of last year. With the reach of millions, we are constantly putting forward a people before profit narrative that is so badly needed around COVID. Unfortunately, this isn't just directed at countering the government's disinformation, but also the inaction and weak opposition from the Labour leadership, who have been letting down working class communities, disproportionately disabled people and Black, Asian and ethnic minority people by failing to offer effective opposition around COVID. We've also been supporting and beginning to bring together grassroots activists, particularly in the trade unions, to work together over COVID, but also to try to use the heightened visibility of the unions to build our strength as socialists in the workplace. There are many examples of workers on the front line during COVID, many of them working through it with little to no extra safety measures in place. Obviously, NHS staff and care workers have been at the forefront, but alongside them, transport workers, education staff, construction workers, delivery drivers, supermarket workers, and many others have kept the country running without being able to work from home. Where unions have been organised and stood up, they have made a real difference, not just in the workplace, but to the direction the government has been taking us. The awesome organising of primary school teachers this January is a clear example. The government tried to force the unsafe reopening of schools on the first day of term, but found they had lost control of the school system. NEU reps were en masse submitting Section 44 notices to head teachers, who were very often glad to receive them, saying their workplaces were not safe and they would not be attending. By the afternoon, the NEU position had won out and schools joined the lockdown, opening to only key worker and vulnerable students. And no one wants to see children out of school, and had the initial lockdowns been earlier and more comprehensive, we could probably have had children in school for much more of the past 18 months. I've got 2 school-aged children myself, and of course it's been challenging. But the government has consistently failed in its strategy, and the unions have pushed back each time because they've had to. We are also seeing NHS workers rejecting the miserly government pay offer, in reality a pay cut, and it's imperative the whole movement supports NHS staff campaigns who are campaigning on this, not only because they deserve a real substantial pay rise, but also because the organisational strength that can be built as a result will help in terms of community safety as well. We are seeing a more confident and vocal workforce who increasingly know best how to protect themselves in the face of this devastating pandemic. Now, the Momentum leadership is made up of rank and file members of the Labour Party and trade unions. We have care workers, NHS workers and teachers on the NCG who have been speaking out about the need to fight for a strategy based on the science and to resist the government's plans to simply let the virus run riot. But we need to do more to build a movement to protect workers and fight for justice for those who have needlessly died of the virus, like Belly Majinga, Emmanuel Gomez, and thousands of others. Momentum is working to politically educate our mass membership on workplace rights, to connect socialist rank and file trade unionists, and to foster self-organisation through our new trade unionist network. We want to bring together workplace reps to support each other and share their ideas, knowledge and experience, as well as push for the Labour Party to do its job and put workers' lives and livelihoods before the profits of those who can hide away from the pandemic on their yachts. I'm really pleased to say the next organising session for the Trade Unionist Network will be an in-person event at the World Transformed this Sunday. I believe that one of the organisers is kindly going to put the link in the chat now. So if you're in Brighton, please do join us. And if you're not already a member, join Momentum to help us build power in our communities and workplaces, as well as within the Labour Party. Momentum is the members, and we can't do any of this work without you.
Thank you very much, Sonali. So thank you everybody for coming. That's the last of our speakers. And the meeting will be available, as I said previously, on Twitter, Facebook, and the ZeroCovid Coalition YouTube channel. So good luck to everyone at conference, and please attend the World Transformed as well. It always has fantastic sessions. And let's bring ZeroCovid onto the conference floor, and let's convince the Labour Party that it is the most important thing going forward from here. We're going to save lives, save the economy, and we will be all looking for a better future ahead of it. Thank you very much.